Board of County Commissioners today on Tuesday, March 17th. We have called a special meeting here at the start of this to address some ratification of emergency ordinances, or excuse me, emergency resolutions. We are practicing social distancing, so I'm going to cover a little bit of how this meeting's going to be run, since we have some people in the room and some people participating virtually. Before I start into that, I want to see if our board is all present on the phone. Greg, I can see you. Steve, are you still with us?
Yes, I'm here.
Okay, and George, have you been able to join?
Can you hear me?
Yes, I can hear. We can hear you great.
You can't see me.
Now I can see you. Hi.
Oh.
Your very nice green sweatshirt. Nice to see you. And Patty Clapper is here with us in the room as well. So as we conduct this meeting, we have some folks who have chosen to participate via Zoom link, which was published on our agenda. There's also a call-in option for the public. You may watch this on Grassroots, either on Grassroots TV or on their live stream online, and also participate by phone. Because there is a little bit of a lag between what you will see on Grassroots and what we are talking about in the room, I am going to go a little bit more slowly than we otherwise might have when it comes to the public hearing. So folks who wish to participate will have the option to call in. And as a matter of course, what I will do is check in with folks in the room for comment first, and then we will move to folks on the phone. For public comment, I will ask that individuals with last names A through G provide comment at a certain time, then H through O, and then P through Z. So if we do have a critical mass of people on the phone, you're not all talking over each other. And when we get to that portion of public comment, I will remind that as well. So let's go ahead and move into our special meeting agenda. First item is an emergency resolution ratifying the Pitkin County Manager's signature implementation of Pitkin County's Colorado Local Disaster Emergency Declaration.
Thank you, Kelly. And I just want to take a minute to step back, both to put some context around both of the emergency actions that we're requesting the board to take. But before, and stepping back is going to be repeating some of the messaging that we gave the community yesterday, but also making sure that the board and the public that might be on our virtual meeting get a little bit of an update of what's going on, particularly with our emergency response, as well as forthcoming information about assistance that may be available to those who have been impacted, particularly by the closures and cancellations in the last 48 hours. But before going into that, I just want to remind everyone that the strength and resilience of a community is demonstrated during challenging times. And this is an unprecedented time. Now is our time as a community to pull together and show the state and nation what a great community we live in. This is an opportunity for us all to demonstrate our compassion, patience, and above all, an unfailing effort to support each other. And we need to keep that in mind because people are scared right now. And people are in need right now. And we are going to have opportunities forthcoming for community members to help and play a role. We'll talk about some of those today. But right now, the most important thing that we can do as a community to help each other is social distancing. I know it sounds simple. It sounds maybe oversimplifying a complicated situation, but right now the best thing that we can do for each other is make every effort to stay at least 6 feet away from each other, to have our interactions as much as possible electronically, to not put yourselves or your neighbors or your family at risk. So please follow the public health guidelines, follow the public health orders that are in place to protect you and to protect our community. With that, of course, I'm sure everyone at this point is aware that we have a worldwide pandemic. On January 30th, the World Health Organization declared the worldwide outbreak of COVID-19. On March 8th, the Colorado Department of Public Health and Environment confirmed a case of COVID-19 within Pitkin County. As we conducted our public health investigations, we made the determination that the community spread of COVID-19 was likely, and that means we couldn't trace back to a source that could be specifically isolated. And on March 12th, I signed the disaster declaration that I'm requesting the board to approve today. That disaster declaration, in essence, is a recognition that we have an event that may have either, in this case, probably social and economic impacts that are beyond the county's ability to manage by itself, and we will need state and federal aid throughout the process. But before we turn to this specific disaster declaration, I'd like to invite Tracy Truelove, who is our Public Information Officer. If I use acronyms, please call me out on that, to provide an update on the incident management team and Joint Information Center structure.
Is that one on? Yeah. Okay.
How about now? Oh, this is a really tiny
I know
chair.
that's a. I don't know.
I'll be all right. I'll stand up. I'll sit up tall. How's that sound? John, thank you for inviting me here today, and commissioners, I appreciate it. Ooh. Sounds like there's a little
You're
bit
going
of
to hear it
feedback.
from lots of directions.
Thank you. So yeah, just to kind of give you an update on the direction that the Pitkin County Incident Management Team is headed in. Currently, there's about 27 people that we're still meeting but practicing social distancing in the incident command post where we are. And one of the things we recognized after last week, which I would almost call like our initial attack phase of the incident management team, we've moved kind of more towards setting up a joint information center. We recognize this is now becoming a much more communications, again, heavy. It was heavy last week. It's going to continue to be heavy moving forward, but communications heavy incident. And that doesn't mean that our operations and logistics and planning teams aren't in place and working. They are doing all those things to kind of meet what comes in each day. And that's just it, right? We are still in this mode of having to react to kind of what this state structure is set up in and how we respond to what is coming at us each time. But what I can tell you with the Joint Information Center that is an extreme help to the team that I'm supporting is we now have some more bodies helping us to, I guess, corral the information, right? So we've got this arm of it that's education that people are really interested in. What does social distancing mean to me? So we're working on how to be sure we're getting that message for our community pulled together in as comprehensive way as we can. We still have that incident in messaging coming in. For example, the governor's order yesterday about the restaurants, and then our public health team takes that information and turns it into how that, again, feeds the Pitkin County community. And so that's all stuff that you're seeing rolling out today. I will share that this couldn't be done with just a couple people. And so what has been a tremendous help for us out there in the JIC, we call it a JIC, Joint Information Center, is the support of several other places here. Snowmass Tourism and the town of Snowmass Village has stepped in to help us there. SkiCo, my partner at the city of Aspen, Mitzi Rapkin, all of these folks are now Aspen Valley Hospital. We're all kind of in this coordinated effort to make sure our communications are, again, consistent and effective and as timely as we can get out to folks. We kind of have a core team working out of the incident command post, and we're practicing what we preach, and we have a lot of people that are helping us remotely. So you'll continue to see a lot of that kind of structure being put into place because, again, we don't understand yet how long that's going to take us, right, or how long we're going to have to be in that sort of incident command situation. You know, I'm really open to questions probably around that. There's, again, just the community should know there's people still actively supporting it. One of the things I feel passionate about, though, is some folk, we need a break. You know, we need to find a way to schedule people differently so that people are going home, being with their families also, and staying healthy. You know, we all have to do that. So that's a lot of what we're kind of working on, too, is how we build out our schedule and our structure and taking care of people, just like we're asking the community to take care of each other.
Okay, let me go in the room here for questions for Tracy. Patty, do you have any?
You know, when you talk about the time frame, I think that's, we're hearing it from everyone. How long is it going to be? Is it going to be over in August? Is it going to be over in June? Is it going to be like a flu cycle? My concern for the Incident Command Center is how long are we going to stand that up, and how are we going to sustain it? Because we've never had an incident. I mean, Lake Christine was a test for this, but you know, we were, like John said, you could see it. This one we can't really see. So do we have any concept as what other resources we might be in need of? I know that they're trying to stand up things on a statewide level.
You know, Patty, this event, I think, has evolved so quickly for us that right now we have been really in the incident management space at this point. As we hopefully get ahead of the curve in terms of implementing all of our social distancing strategies at a state level, local level, and national level, that we can take some time to step back and understand what does that epidemiological curve look like? How long can we expect to be in this event, and do that planning? I think to Tracy's point, if we could give folks a day off before we get to that next step of planning, that's we're really looking at right now that next step ahead, and we'll be taking a step back as we get to a more I think solid place in terms of the changes that we're making to deal with this pandemic, and come back to you guys with that.
You know, I think it's important too that so that whatever the Board of County Commissioners can do to help with, you know, the resources needed, we're here. That's why we're here. The other thing too is I want to just really quickly thank everybody who's been working all those hours and all those days in a row to help us get a grip on this. And I know we have an unknown how long, how intense, or, you know, the goal is to level out the incidence of exposure, the incidence of people who are coming down symptomatically. And I think it's taken us all. It's taken us all to get there, and that includes the community and them respecting any issues that we send out to them about social distancing or closures, et cetera. We mean it, and we need their participation in this. It's critical. Thank you.
Okay, let me check in with board members on the phone who would like to ask Tracy any questions.
George here.
Yeah, George, go ahead.
So we're getting emails from the state and from our representatives saying that there are resources that are being appropriated, whether dollars or staffing, to help from anywhere from testing sites to call-in help. What's the status of Pickens County being able to tap into any of those resources being provided?
So, George, I think the nature of this event and it evolving so quickly is we're continually catching up with that state guidance relative to testing. It's really for the type of testing that was already conducted in Pickens County. Some of the other communities or regions around the state are running about a week behind just where we were in terms of experiencing this pandemic. And so those testing resources are really along the lines of what we have already conducted. We made once we made the determination that we were in a community spread, that were no longer necessarily containing the virus with isolation of known cases. The testing strategy changed to really those with the most significant medical indications for testing. And, you know, one thing that I think the public needs to understand is that right now the state lab has the ability to process 160 tests a day. When you look at that, that is equivalent to the ability to test about 1% of the state's population in a year. It would take 5 years to test 5% of the state's population. Now, there's strategies we understand forthcoming to partner with private entities to speed up that testing and to expand that capacity, but that guidance isn't here. So when our community is seeing that those resources are available, they're actually, we're beyond that stage in our response right now. As far as other resources, I know Nan is going to have a little bit of an update for us about some other available resources that are coming down, I think, at the federal level and potentially locally. So if we could parking lot the rest of that until Nan has a chance to speak, that'd be great.
Great, thank you.
Okay, let me check in with Greg or Steve. Questions for Tracy?
Greg here. I would ask Tracy the comment I heard regarding fatigue on part of the IMT and the Emergency Operations Center. Have you had resources coming in from the Forest Service or other federal agencies, people with training in emergency management? Do we have assistance from outside to relieve you all so people can get some rest and get some recreation?
Yeah, it's a great question, and it's actually funny you asked it because I called my dear friend from BLM the other day to just say, hey, Dave, what are you doing? And he broke his leg 2 months ago and he's still not driving, so he wasn't going to really be a good resource. But it's an interesting question. We actually started to talk about this last Monday as a team, recognizing we didn't know what was going to potentially, we know this is a long-term kind of thing. I understand the state is looking at those type 3 level incident management teams and how to mobilize, but what we recognize also, they're supporting their home units as well. So it's still, I think, something that's in the works. I believe we're going to have to see the state kind of move that forward in a different way for that to happen. But what I can tell you is most impressive to me, again, is our locals who have had maybe some training, who had maybe not any training, but are willing and eager to come in and help us. And I think that we're going to continue growing some of those people here in our community to support what we can until something else changes from that that type incident that occurs.
Can I just real quick tackle?
Yes, Patty, go
Just
ahead.
real quick, Greg, thanks for bringing that up. Because we did get a notice from Senator Michael Bennet that he was reaching out to our federal partners to see if they could be of benefit and use to us. So I want to thank the Senator's office for doing that so that we have opened the door. So if we can tap into the Forest Service again or BLM at other levels other than broken legs, hopefully we'll now be able to do so.
Steve, is there anything you'd like to ask Tracy?
Yeah, this is Steve. I'm looking at the emergency resolution, and I looked on the map. The state, it was actually emergency resolutions from clear around the whole country, and it showed Eagle County as being one county that has an emergency resolution. Is the one that we have, is it like a copy of the one Eagle is using? Are we coordinated with the wording and the the strategies that Eagle County's doing. Also, I know we're coordinating with Garfield County on a lot of things. I think the more that we stick together, the better off we'll be.
Steve, we've had really remarkable coordination with our partners in Eagle County, Garfield County, Summit County, and Gunnison County. In the case of this emergency declaration, yes, I did coordinate with Jeff Schroll in terms of language. Our language will be different because we're a home rule county, and so you'll see some differences, but I think you'll see a lot of similar language in our declaration to what Eagle County did. I think more importantly than the declaration, though, we issued our first public health order in the state, really requiring social distancing around events and gatherings. That was coordinated with Eagle County, Pitkin County, and Gunnison counties. And so as much as possible, in the absence of those types of guidelines coming to us from the state or from the federal government, we've partnered with our neighboring counties and we've acted together and we've stayed very coordinated, and they have been fantastic partners for us.
Okay, thanks, John.
Okay, thank you, Tracy.
Yeah, but before I leave you, I want to just add a couple things because you have such a good following. The best information is always going to be coming through the Pitkin County website and the Pitkin County Public Health Facebook page and website that's been created. It's always good to remember to go to that official source for kind of the emerging and breaking news. I will share that we have pretty active social channels that haven't been active here before, so that's kind of one of the challenges for my team. But I want people that are posting on there to recognize, we want that channel to stay open for, questions for people who are worried, scared, concerned, don't know where to go. When you start to post other things that really kind of take us down a rabbit hole, that's a tremendous amount of a drain on the resources that are really trying to get people the best information they need. So I would just really encourage folks to look at those channels and use them in an appropriate fashion.
And can we add too, again, I think it never hurts to add this as often as we can. The Pitkin County now has reached a multi-county hotline, is 970-429-6186. That's to field questions about symptoms, what people should do or should not do, and some general information or some resources. We at times have questions that are asked that we don't have answers to. We do our research, we do our homework, we reach out and can always get back to people when we're able to find the answers to their questions. So please, again, 970-429-6186.
Thank you very much, Tracy.
Thank you, Tracy.
We
Thanks,
appreciate
Tracy.
you
Nice to
being
see
here and
you.
all the work you're doing for us. And before we consider the resolution, if we could also ask Nan Sundin, who's head of our both our Department of Human Services, but right now is acting as the Emergency Support Function 6, which is mass care, emergency assistance, temporary housing, and human services annex in our Emergency Operations Center. Obviously, the cancellations and social distancing requirements have created real challenges for employment in the community, and we want to talk about resources that are available for folks. So.
Yeah,
Great,
thank you.
thanks, Nan.
Good.
Thanks for being here, yeah.
Yeah, thank you. I feels good to be out of my office. That's good. So what I want to talk to you a little bit about are the ways that we're building support for the community, really from Aspen to Parachute. So we're focused on Pitkin, but we're very closely working with Eagle and Garfield and the Aspen Community Foundation and all the school resources throughout the region, Catholic Charities and other partners. We hope today to have, it will happen today before we go home, that on the Pitkin County website, there will be information for people about Aspen to Parachute COVID relief programs. There will be phone numbers, there will be links to website, and on our website we will have forms for people to call if to fill out. That will come in a Google form asking for economic assistance. Eagle and Garfield will do it a little bit differently with phone calls, but that will be on our sheet. So we're setting up a form in Pitkin where people can apply for the Emergency Assistance Fund, which we've had since 2008, since the recession. So that works well. It will be for people who are impacted by the COVID, by losing work, people who don't have money now to pay their rent, their utilities, they need supplies, diapers, whatever, and other, trying to think, I wrote it down so I wouldn't forget, mortgage and rent, right? We're set up to act quickly in Pitkin. Eagle is set up to act quickly in Eagle. Garfield is setting up to act quickly in Garfield. Because we are a governmental entity, we can't always support the undocumented with cash assistance, but our school resource centers can, and Catholic Charities. So we're building a system for our whole community. We're not going to leave anybody out, okay? So we'll have this on the site. There'll be phone numbers, emails, forms. The Aspen Community Foundation, we had a meeting this morning, and they are going to serve as the what Emergency Management calls a VOAD, which is a Volunteer Organization Assistance in Disaster group. So on Thursday, they're going to have a call with all the nonprofits from Aspen to Parachute to try to start coordinating all these food relief programs and utility relief programs and everything. And that will feed information to us, of course. And also, we clarified with the Community Foundation that they are not providing direct disaster assistance. The best thing that they do is raise money, and they can support the nonprofits who are providing the disaster assistance. So we're excited about that clarity. It was a little confusing in the last couple of days. The last piece that I want to, two things. One is that the Pitkin County Senior Services Center is supporting seniors at home who can't come in for meals because it's closed. They now have 50 seniors that they're serving meals to daily, 4 days a week. If any senior needs anything, they can call 920-5432, and Chad and the team will figure it out. Always our priority is to use federal dollars first, state dollars, and then local dollars. So we have triggered the TANF Assistance Fund that you all approved in policy last fall. Yay! We just barely got it in. So you all approved the policy in November or December. It allows us to use, so a reminder, TANF, Temporary Aid to Needy Families. In Colorado, it's called the WORKS program. And it's basically meant to be a welfare to work. Those are old previous terms, but program. In a disaster, we can support families that have an income of less than $75,000, have dependent children in the home, and are lawfully present. So we will use those dollars first for our families. In reserves, we have $100,000. So in our allocation is about $80,000. So we're already spent in our allocation. We'll be using our reserves. The state says there's no more money after that. So we'll be using the county pool. We're also in touch with CDHS on a daily basis, waiting to hear about federal relief and how we can use those programs first before we use county dollars.
And can we have the number again for the senior?
920-5420.
And I'm going to see that that's added upstairs to our hotline in case any seniors.
We're good, thank you. We're going to feed the hotline all this information.
Okay, perfect.
Once we organize it. We have a new number for the COVID economic assistance, so we'll be publishing that, 429-3350. And so I think we have set it up. Just an aside, we keep talking to the ski company because they really want to help. They have employees who are want to do something. And just before I got here, they said, we could be a call center. We've got people, we've got a system, we can take, so it's going to all come together. And we just so appreciate that even as we start today, we might have some bumps, but I really believe that within, the next few days, we'll have a smooth response machine.
Thank you, Nan.
That's
Is,
great, yeah.
John, anything you want to add? And then we'll go to comments from the board or questions.
It's a lot of good work happening.
Patty, anything else?
Nan, that's nice to know, because I was just looking at the sign-up sheet for the hotline. The hotline, again, is 8 to 8, 7 days a week. And people can man the hotline for us, give sheets of information. So it's not like you have to be an expert in the field. The information is all there in front of you. So that would be great if we can share some employees with the ski company.
Yeah, so and to be super clear, so Phyllis can call the ski company, I'll give her that information.
Yeah.
Valerie Carlin at the Community Foundation is going to be the source for requests for volunteers and volunteers who want to be of service. So people can email Valerie at aspencommunityfoundation.org if they have a need or a resource. And that organization, thank you God, they're going to organize all that.
Perfect information to have up on the wall in the hotline office upstairs.
Yeah.
So we can always refer to it. That's great, Nan.
It's
Thank
on our
you.
sheet. That's going to go on our line. That's going to
Put
go
it up on the wall. We're calling it the Wall of Fame upstairs.
Fingers crossed.
Okay, let me go
Thank you.
to board members on the phone in case they have questions for Nan.
Greg here. Hey, Nathan. I understand the Community Foundation is also taking donations from donors, and I want to just make sure we can perhaps we can get that contact information as well, if there's a phone number or if it's separate from Valerie. If somebody's looking to help out financially, as people in this community can, that they could contact the Community Foundation as well if they're a donor looking to give money to this.
Yeah, thank you. I will add that information, and they do have an email now for COVID disaster contributions.
Great.
And I'm sorry I don't have that right now, but I will.
Great, thank you.
That to you.
All right, George or Steve, anything for Nan?
This is Steve.
Go ahead.
Nan, I know you're on top of this, but there are vulnerable populations in our community. The senior citizens being one of them, the homeless people being another. And I think the kids who are not in school probably could be added to another group. Maybe there are others. And I know you're thinking about this all the time and on top of it, but I appreciate any efforts you can put towards remembering those forgotten ones who sometimes don't get the services they need. Thank you.
Yeah, thank you. Of course, the Senior Center is all over supporting the seniors, and they're a really amazing center of excellence for us, and they're a trusted source for seniors. The Aspen Family Connections, as we speak, has a food drive going on in the middle school right now. They're offering their phone line for families in need, as are all the family resource centers. And the homeless are sheltering at the Health and Human Services building for now because St. Mary's had to close, and we're staying closely connected, and we've linked the Aspen Homeless Shelter with public health so they can get medical guidance to make sure that everyone stays healthy.
Nan, thank you.
George here.
Hi, George. Go ahead.
For Nan, or maybe even for John, going back to our hotline, our call center, that the county really got that up and running very, very quickly last week. My concern at that point was in terms of the ability to sustain that just with our staff, with volunteers, and now hearing from you, Nan, that the ski company have employees that are happy and willing to help. How will that process get incorporated with either our call center or one of theirs?
Yeah, so George, we've been careful in expanding our capacity there. I want to thank all of our partners. It did start off with county employees who volunteered and some board members, I would note. However, we have also had resources added from our municipal partners to staff that hotline. We've had a sign-up sheet out there, and so we've had a pretty good rotation going right now. As we have more of these resources come forward, and again, this has been happening so fast. We are looking at how we can incorporate other volunteers. We want to be mindful of maintaining our social distance. We want to be mindful of how we introduce a broader group of volunteers to be in that space with those phone calls. So we're working on that, and it may be that the call center options start to take on different responsibilities in terms of response and information. So we're still working on that, George, but certainly we're taking advantage of these offers of resources to make the call line sustainable. Frankly, we thought we may be turning that hotline off after the weekend, but it is getting so much traffic, and it's morphed into really a great information source for the community. And so we're going to find ways to make that sustainable in the long run.
Can I just add one thing I forgot that's really important is that our mental health providers have totally stepped up. Hope Center, Mind Springs, and Aspen Strong. They are alternating weeks so that if the call center gets someone who's super anxious or nervous, they do a warm handoff by phone. So right now the Hope Center is taking the calls. Next week Mind Springs will take the calls, and they agreed to alternate. They've also set up virtual therapy because their offices are mostly closed, and everyone can get resources at the Aspen Strong website. And find out who's doing mental health and behavioral health. And so we're happy to have that as well.
Okay, any additional questions for Nan? No, I would just like to, Nan, thank you for leading up that emergency support function team.
Yeah, we have
I can't imagine a better person to shepherd all those resources with your long career and contacts. I'm sure it's made for this moment, so thank you.
Thank you. We have a great community, and we've had great partnerships for a long time, so that part is easy.
Great. And we look forward to getting all this information collected in one place easily for the public to access, so thanks for your work on that.
Thank you.
Thanks, Nan.
Okay, let me check in with the room about additional discussion before we entertain a motion on the resolution. John, anything else you'd like to add?
I think this is a great example of how we're pulling together as a community while staying apart. So thank you.
Patty, anything else you'd like to add?
No, I just want to thank everybody again for everybody stepping up.
Okay. And board members, anything before we go to public hearing?
This is Steve. Just some editing things. The emergency resolution that we have before us, there are some words that are different from what was in John's emergency declaration, and they're really more just Scribner's errors. And so I could, maybe it'd be better if I just emailed up. There are 4 different ones that I saw where there were different.
I'd like to hear them.
We can capture those, Steve. I know there are some corrections to the emergency declaration that I signed, which was maybe done a little bit more quickly than the one that is in front of the board for ratification. But we can certainly catch, if there's Scribner's type issues, we can catch those for the confirmatory reading if you want to get those to me.
I'm going to check in with Patty. It sounds like she might want to hear them.
Steve, are yours? No, I think we can handle if we do it a second. I just picked one that should be travelers, not travels, just simple things. I just didn't know if Steve had something substantial that he wanted to.
Okay, so I'm just going to read the title of this emergency resolution before we go into public comment, because this is a public hearing. So it's titled, "The Emergency Resolution of the Board of County Commissioners of Pitkin County, Colorado, ratifying the Pitkin County Manager's action on a declaration implementing a local emergency disaster and extending the declaration until rescission by the Board of County Commissioners. So we will go to the phone for public comment. I will first ask that folks whose last names beginning from A to G provide comment, then H to O, then P to Z. And we will delay for a moment after everyone on the phone has spoken to see if anyone else calls in. So let me go ahead. Is there any public in the room who wishes to comment?
Kelly,
Yes,
can I ask John a quick question that hasn't been brought up yet?
sure.
As part of this resolution, John, talk about the budget, the funding that we're doing.
Yeah, so probably budgetary implications for both of these, George. So the action in front of you right now is on the emergency declaration. And as Nan had indicated, we're getting indications that there's going to be additional funding and appropriations coming down through the federal government to deal with this pandemic. Those funding sources are probably going to come through multiple agencies, including the Federal Emergency Management Agency, or FEMA. This disaster declaration really starts the clock for eligible expenditures within the county to draw down those funds as they're appropriated by the federal government. I don't know if you want me to talk about the second resolution, or do you want me to?
Our next item on the agenda for our special meeting is the resolution for additional appropriation. So I'm going to hold off on that conversation until we get through the public hearing for the declaration. And then John will go into the details of our appropriation second.
Great, thank you.
Okay, thank you. Okay, so do we have any members of the public on the phone with last names beginning A through G who would like to provide public comment?
Yes, Sean Irene.
Can you repeat your name, please?
Sean Irene.
Okay, go ahead, please.
I have been working at Device Line and I've been laid off, and so at this point, you know, I'm not going to be able to have the 1,500 hours that's required for housing, and I, you know, in regard to relocating, I think this is a situation where now it's escalated to a lot of these communities not going to be able to work for 1,500 hours. So, besides the fact that the board has not allowed him to provide the proof that he has worked, it's a concern for everybody in the community now.
Thank you. We can carry that message and question to the APSHA board. Is there anyone other public on the phone with last name beginning A through G who would like to make public comment? Okay, is there anyone on the phone with the last names H to O who would like to make public comment? Yes, hello, go ahead.
We're going to get feedback.
Can you tell us your name, please?
My name is Lee Matheny.
Go ahead, Lee.
Okay. Are we allowed to comment or discussing an after board meeting later in the meeting? Can I comment on that?
Lee, we are taking public comment on the emergency resolution ratifying our local disaster emergency declaration.
Yes, ma'am, would you be taking comment on the latter portion of the meeting later on?
We will not. This is the only portion of our meeting that has a public hearing component. We will close the special meeting and then go into work session later.
Yes, ma'am. And when would the next public comment be? Please.
We take public comment at the beginning of all of our BOCC regular sessions. The next one is scheduled for March 25th at this point.
Thank you so much.
Is anyone else on the phone with last names H through O wishing to provide public comment on the emergency declaration? Okay, is there anyone on the phone with last names P to Z wishing to provide public comment? Given the lag time between us in the room and grassroots, I'm going to wait about 45 seconds to see if anyone else phones in. Thank you for your patience. Is that Lee?
Yeah.
I think we can hear public on the phone. May I ask you to mute yourself, please?
I have a process question real quick.
I have about 5 more seconds. Check in again.
Kelly, you're doing a great job. This is Greg. You're doing a great job.
Thank
It's
you.
not easy to run a meeting by phone.
Okay, I'm going to check in one last time with the public to see if anyone else has called in to provide public comment on our emergency resolution to ratify the emergency declaration. Okay, hearing none, I will close public comment and I will bring it back to the board. Any discussion here in the room?
Yeah,
Patty?
I just have a quick question. So this is an emergency resolution. When does it come back for confirmatory reading and public hearing? Don't we, because we're,
It's got to be 2.
It will be posted and noticed and brought
We-
back at a regular
okay.
meeting.
Yeah, we'll post it for ratification at a regular meeting, Patty. I think we're going to have some conversations about how our future agenda calendars may be affected if we have to have any further close down.
I
of
just wanted to let
facilities.
the public know that this is not their last chance to hear this, and
That's correct.
this may come back in another form, so we may be continuing an emergency resolution with more public comment as we move forward, because as John, as we've said, things are changing rapidly, and we need to address them in a timely, as best we can, timely manner. Thanks, Kelly.
Thank you, Patty. Let me go to commissioners on the phone. Any comment, any conversation? Commissioners? Okay, if there's,
Right here,
yeah.
I'm good.
okay, I will entertain a motion, please.
Yeah, I'm good.
So moved. Greg?
And I will second.
Any further discussion from commissioners? I just want to note that in our role as electeds, we are working hard on behalf of our constituents in Pitkin County to bring conversation and requests to our state elected officials and appointees, as well as our federal elected officials and appointees. And we've been actively having those conversations in coordination with our county manager and requests of our Emergency Operations Center. And those include for the state to coordinate with us a bit. We've had to act very quickly, sometimes ahead of the state, given the outbreak here in our community, and trying to get more aligned with decisions that the state are making here at the local level. Additionally, as well as aligning messaging at a statewide level, that things that we're doing in Pitkin County and have been messaging on regarding social distancing and public health order closures are beneficial for everyone across the state, not just in our mountain communities. And then finally, we were on the phone with our congressional delegation this morning, asking for clarity from the CDC around what they see as our future horizon for the epidemiological curve and the extent and length of these public health orders and shutdowns to help us in our recovery planning. We've asked for more information on federal economic assistance, in addition to how we're helping small business and the self-employed. We know we have a lot of self-employed people here in the county. And then finally, some clarity about the big picture focus on testing and how those testing is how that's going to be paid for, and more information to come. But we are actively elevating those questions on your behalf, and we'll have more to report in the coming days and weeks. So I will call the vote. All in favor?
Aye.
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 One more.
I only heard 4. We got everybody off mute?
Greg here,
Okay. Okay, thank you very much. Let's move on now. The next item on our agenda, still in our special meeting, is an emergency resolution increasing the 2020 budget for our COVID-19 response. And here we have our budget director, Connie Baker.
Good afternoon.
Thank you.
Every year, Pitkin County appropriates $150,000 within the manager's budget for emergency response. Up until this year, we had never tapped into those funds. It was just there in case, and originally we called it a wildfire fund, assuming that that would be the type of emergency. At this point, we're asking for an emergency resolution to increase that amount to $500,000. We don't know the extent yet of what the county will need to pay for. Right now, this is just giving us a reserve to work from. This resolution leaves the $150,000 within the manager's budget in the general fund, and then appropriates the additional $350,000 within the public health fund. That's where we've set up all of our coding for our emergency COVID response at the moment. Then there's also the transfer of fund balance from the general fund to the public health fund to cover that appropriation.
Then I would just add, this is an unprecedented event, and it's unprecedented for us to have such a significant closure of the main economic drivers in our community. And so this asks for appropriation, as Connie said. We're requesting some flexibility in terms of how these funds are used. Examples would be supporting activities for emergency response for our community members who are unexpectedly out of employment, and to fund those sources where state or federal funds are not otherwise available. To fund any of our public health response initiatives, whether that be acquiring personal protective equipment to ensure that our first responders and healthcare workers are able to have the types of equipment they need so that their services are available, or whatever is coming at us over the next week. We expect, given the scope and the scale of this event, not only in our community, but in the nation now, that we will have need of these appropriations. We wanted to be sure that we had enough so that we could respond quickly to an event of this scope. I suspect this will not be the last time we're in front of this board requesting appropriations for the various response activities for the community, but we wanted to be sure we had adequate resources to bridge us for a significant period of time in response.
And also, as the response evolves and develops, we may come back to move some from one fund to another depending on where those expenditures are occurring.
Okay, great. Let me go in the room for comments by commissioners. Patty?
Yeah, I'm a little confused at the document I had in front of me. I'm seeing 700,000 come up.
So
can you just kind of explain so people?
Sure.
Is it 5? Is it 7? Is it, where are we getting it? Where's it going?
So we are increasing the expenditures in the general fund by $350,000 so that we have a total of $500,000.
Right.
But we're transferring money to the public health fund.
So we're doing both.
So when you do a fund transfer, even though it's $1, you account for it twice so that the public can see this is the
Right.
amount that's appropriated in the general fund, then we're transferring it. But the real amount of spending authority that you're approving is $500,000.
Thank you. The second question is, I want the public to know, since we are moving into, we don't know how rapidly, wildfire season, that we also have a plan. If we need to have funds for wildfire, we have another plan behind this to back this up for response to potential wildfire.
That's part of the reason why the original $150,000 for the moment is being left within the manager's department.
And then I have one last thing. We all, I think, agree valley-wide, especially in Pickett County, and I think valley-wide and beyond regionally, statewide, and hopefully this country, they're all in this together. So I just don't, have we reached out to partners, like for example, the City of Aspen Snowmass, to find if there's any assistance from their budgets, since we know we had some great windfall in sales tax revenues this year. So maybe we can get some assistance and work that out as to where those dollars might go. I know the City of Aspen has been talking about one of their funds that may give us an opportunity to help out at a more substantial level, perhaps.
I think all entities are going to have a big part in this response going forward.
Because, again, we're all in this together, and as much as we would like to shoulder the burden with all the financial, we just don't have that within our resources. We're going to need some help, state, local, regional, and federal. Okay, thank you.
Thank you, Patty. Let me go to commissioners on the phone for questions or comment. Okay.
Greg here.
Yes, Greg.
Kelly. I would just like to ask John and Connie, I know you can't really look too far into the future, but I'm wondering how soon you anticipate coming back to us regarding another appropriation, because the impression I have is that we're going to be relying on all sources that we can, but this could possibly get used up fairly soon.
Gosh, Greg, I've stopped predicting how fast this thing is going to evolve on us, but I think over the next week we are hoping to get a chance to kind of catch our breath on the initial response and what we've had to implement in terms of social distancing and our initial response to this, and so. We'll probably have more clarity on that after this week, and once we probably see what the initial asks are for assistance from our community. Like I said, this is unprecedented, but hopefully in the next couple weeks we'll be able to give you better indications of what the demand on resources is, get a better handle on what that burn rate might be, and when and if we need to be coming back. It's very possible that the next appropriation is to really appropriate federal funds that are coming down through the state. That would be our hope. Mm-hmm. So our goal with this $500,000 is really to bridge us so that we can have time for our federal and state partners to catch up on their plans.
Thank you.
Thank you. Mm-hmm. Any Steve or George on the phone?
This is Steve. I'm good. Thanks for that explanation, John. That sounds better. I'm thinking of the big surplus in our sales tax money that we talked about a couple of weeks ago, and I'm thankful that we had that big surplus from last year, because we might well need every bit of that coming up here.
Yeah, thank you, Steve. And of course, we're going to be assessing what we believe the longer-term economic impacts are going to be for our community and our organization. I know I keep saying this, but we are in an unprecedented event here. And so I know I've started looking back at how past kind of shocks, whether it be September 11th or what have you, impacted our economy, but this is different. And so we'll be spending some time to do that planning, and I think we can expect that this will be a significant impact.
Thank you. George, anything?
I'm good. Thanks.
Okay. And I'm realizing I'm running us over time. I'm not doing a good job chairing here in that element. So I do have one question. We did hear from Nan about economic assistance, specifically towards individuals and families. But with regard to this budget, can you talk about the types of things that this will be spent on? Yeah, so the emergency fund, as Nan kind of described it, we try and use our local funding last to provide for those emergent needs. And we're fairly flexible in terms of whether those needs are housing or food or transportation or childcare needs. So we try and evaluate that on a case-by-case basis and what those needs are. And so the gaps for individuals that may have lost their employment unexpectedly or have other challenges related to COVID-19, we'd be evaluating those needs individually, Kelly, and then if there was not another federal or state source that could help that person stay in a healthy place, then we would be tapping into these local funds. We expect that there's going to be a lot more requests for those local funds. So I guess that's a long way of saying we really try and meet people where they are. Okay. So just to clarify, this fund could cover some of those economic assistance needs. It's not restricted towards, response supplies or PPE or things like that.
That's correct.
Okay.
We're asking for flexibility to meet the community's needs. And as Connie had indicated, we may need to come back because that's a different fund now. We're come back and reappropriate those. But the purpose today was to get a baseline of expenditure authority to try and bridge us from the time that the state and federal government may be providing additional assistance so that we can respond to our community's quickly growing needs more quickly. And so you've given us that expenditure authority. We may need to do some cleanup on the backside as far as the funds.
Okay, any further discussion in the room or on the phone? I would ask for a motion, please.
George, I'll make a motion to approve.
I'll second.
Okay, Patty seconds. We have a motion from George. Patty seconds the emergency resolution of the Board of County Commissioners of Pickens County providing a supplemental appropriation for the 2020 budget and amending the 2020 budget for COVID-19 emergency response. This will be come back to us for ratification at
on April
regular
8th.
meeting on April 8th.
And that will be a public hearing.
Okay, further discussion? Hearing none, I'll call the question. All in favor?
Aye.
Aye?
Aye.
Aye.
Oh, yeah.
Great. All right, we got 5. Thank you very much.
And board, thank you very much for the support.
Point of order, actually. Were we supposed to open that to public comment?
I think
no, not on a first reading of emergency ordinance.
You can, it'll be on the confirmatory reading. And
Thank
so,
you for that.
Thank you. The support is going to be important for our community, and we appreciate you responding so quickly.
Partners would be greatly appreciated.
Okay. Thank you. Thanks, Connie. Okay, may I please have a motion to adjourn our special meeting?
So moved.
May I have a second?
Second.
All in favor?
Aye.
Aye?
Aye. Aye.
Okay, I hear 5. Let's take a 5-minute break. We'll give time for GR to set up.
Don't go far, guys.
Set up that computer to present. Kelly. This is a
Kelly, that
this
was
is a lot to
really
the
a good
others.
job.
Yeah, you had it really well.
Thanks.
She's like, I'm going to
wanna
be
do this.
organized. I'm going to stay organized. Well, and I've
You're Mr. Technology here. Tell me how.
Okay, thank you. Okay, welcome back, everybody, to Board of County Commissioners work session on Tuesday, March 17th. We are going to move on to the agenda item to discuss Pitkin County's road impact fee study discussion. Since we are doing a combination of an in-person and a video conference meeting, I'm just gonna, again, talk about a little bit of conduct of the meeting. We have presenters who are both in person and on the phone. So I will ask GR to manage how he wants the individuals on the phone to chime into his presentation. And then I will go to commissioners in the room for comments and questions, and then go to the phone for comments and questions. So GR, please go ahead with your presentation.
Thank you, Kelly, and thank you, board. I'm GR Fielding. I'm the county engineer. And as Kelly just mentioned, we do have several people that are on the phone joining us that are going to help with this presentation. This is a little bit of a new day, and we hope that we'll be able to get through this and answer all of the board's questions. On the phone, we have Catherine Christoph, the planning engineer. She works in community development here. She was the project manager for this project in updating our transportation impact fees. Also, we have Dwayne Guthrie with Raffles, Gabe Preston with RPI Consulting. We are here to discuss this update to our transportation impact fee. We've been charging a transportation impact fee for almost 20 years now. And what it does is it's a fee when you come in to get a building permit. It's a fee based on the type and size of development that you're doing that the county assesses to help pay for our transportation infrastructure. For this update, I'm going to ask Catherine, can you talk to the board a little bit before we move on with what other staff members from the county has helped out with this?
Sure. Thank you, GR, for being there to support, this presentation. As the project manager, I work closely with obviously GR Fielding, Ann Driggers, John Ely, and Cindy Hubin, just to make sure that everyone had a chance to review and make sure that they felt as though we were on the right path for their individual department's needs. So.
Thank you, Catherine. So yeah, as I said earlier, the impact fees fund the growth share for capital projects known as things like system improvements. And they are legislatively imposed on a broad class of properties. All right, so we've moved on to our presentation overview. Dwayne, can you give yourself a short introduction, and Gabe as well?
Sure, this is Dwayne Guthrie with Raftellus. We're the prime contractor on updating the fees. I actually worked on the original impact fee study probably 20 years ago, so it's good to be back and working with Pitkin County again. Looking forward to participating in the conversation.
And Gabe, can you introduce yourself for the board?
Yes, it's Gabe Preston here with RPI Consulting. We're subcontractors with Raftellus, and I've met most of you all. So we've been up there numerous times working on lots of different projects. But actually, I first met Dwayne back in, I don't know what it was, 1999 or 2000, when he was working for Tischler Weiss on the original road impact fee. So the band is back together, I guess.
All right. So with those
going on a road trip,
right? That's a good analogy, Patty. We're gonna today go over some of the best practices of impact fees, some of the proposed changes that we have to the impact fee. Again, a big reminder for the board though today is that we have this existing impact fee, and this is an update. We're able to update that fee based on indexes and things like that year to year. but it's really a good best management practice to take a step back and update the impact fee. And I believe the board just did this with the housing impact fee not too long ago. We'll go over the proposed fee schedule, the budgetary impact, and when we wrap up, I'll have Catherine talk about what those next steps are for this. This isn't obviously the board's only bite at that apple, to steal a line from John. So if there are requests for changes or things of that nature from the board, we can certainly bring those back when we bring the impact fee back for adoption in the future. Okay, Dwayne, can you take us through some of the best practices?
Yes, the slide that you're looking at now is a table from a planner advisory service memo that I wrote in 2015. It's actually included in Appendix D of your draft study that you have. And because we've been doing this now for several decades, we have seen significant changes over time between what we have labeled old school impact fees versus next generation impact fees. So some of the changes that we have seen and are also trying to carry out with this update are trying to focus more on specific improvements. Some of the old school fees were more of almost a revenue generating mechanism. There wasn't too much concern about, at the time when the studies were done, about how the money would actually be used. But now more and more people are wanting to know the actual improvements that we're intending to build. So we are getting away from generic formulas and generic need. The 2009 update that was done was based on just kind of a projected increase in additional lane miles and what it would cost per lane mile to build a section of road. And so that is really not so appropriate for particularly parts of the county that are more urban and have very limited opportunities for adding any additional lane miles. We've gone more also to kind of thinking geographically, which is what the graphic at the bottom of that slide, of slide 3, shows. It's actually a drawing from Florida Department of Transportation, which talks about context-sensitive design and context-sensitive fees. So basically, rather than just having kind of a generic approach that we apply to all the unincorporated area, we've kind of tried to think about the improvements that might be more appropriate, closer to urban centers like Aspen, or activity centers, and then versus the farther outlying areas. So part of that changing and thinking spatially is there's kind of a difference as you get closer to the urban centers. The emphasis is more on moving people rather than moving vehicles. And so we are, again, looking at more multimodal improvements as a way to accomplish that. And then finally, some of the other changes that you've already been doing in Pitkin County is you were really aggressive when you did the fees. I think it's been 20 years now that you've been doing residential fees by size. We're continuing that practice. We just updated the analysis. Gabe was real heavily involved with that, where we actually got parcel level data for different travel sheds within the community. We got recent traffic counts. We figured out trip generation rates based on averages for the number of units in each travel shed. And just because of the way the characteristics of the different areas of the county work out, we can actually derive trip generation rates that vary by the average dwelling size in each area. So we've updated that entire analysis and extended the fee schedule now. It used to cap at about 5,800 square feet of heated space with the upper end of the residential fees. On the proposed update, it goes up to 10,000 square feet.
So, Dwayne, I'm going to...
the overview of the practices that we've, and best practices that we've implemented with this update. And I think GR is going to take you through most of the rest of the presentation.
Oh, I was just going to interject one thing right now. And one of the things that Dwayne just touched on was being able to update a bit of these fees based on some of the study that the county actually does itself. And one of those programs that we maintain right now is a traffic counting program. And so when he was talking about travel sheds, one of the things that we do is each year we try to get a lot of different data as far as where our traffic volumes are throughout the county. One of the ways that we do that is we put out traffic counters, and most people don't notice them anymore because they're not the tubes that run across the road. They're these little black boxes that we hang from trees and put up on guardrail posts and things of that nature. And being able to see, because of our unique topography here, where we really have one way in and one way out of a lot of places, how many different trips happen in those travel sheds. And so in the past, it was always hard to do that with some of the larger houses that we have here because they're intermixed with different size houses. But now when we have a community like, say, Red Mountain or even Mountain Valley, where we have, and where these guys got down into the granular data of, each house size on the lots and what the average size of the house was in each of these travel sheds, they could draw a very, very distinct correlation between the size of the house and the number of trips generated from those houses.
GR, can I take a moment to check in with the board and see if there are any questions in the room here?
I'm good.
Okay, on the phone, any questions for GR or Dwayne?
Well, I'll have a few questions, but I'm not sure if GR is done with his presentation yet.
No, I'm not sure either, but I just want to give you guys an opportunity if you want to ask now. You wait?
I can wait.
Okay.
All right, Dwayne, sorry. Dwayne or Gabe, I'm sorry I cut you off a little bit there, but is there anything else on this slide that you would like to speak around, or shall we move forward?
This is Dwayne. I'm ready to move forward unless Gabe wants to add something.
Okay, we are to the major changes to our transportation impact fees. So basically, one of the big things, as I alluded to here a moment ago, was that our current fee schedule cap, it goes up to 5,800 square feet. The proposed impact fee extends that range, and that goes up to 10,000 square feet. And that's based on our recent GIS data that these guys, this team poured over, and the traffic studies that I've mentioned. There are also minor updates to other factors, including fee calculations, looking at more current ITE rates. ITE is an international book that it's a handbook on determining how many trips are typically produced by a certain sort of land use. It's a traffic engineering handbook. The inbound primary trip rate adjustment factors by land use. Average trip lengths were updated based on some of the data in our road maintenance and management plan that's adopted by the county. And weighting factors by the for those trip lengths based on the land use. So the 2009 study was based on a generic need for additional lane miles, and then something was applied to that based on the cost per lane mile. The 2020 update that's here is based on a transportation capacity expansion. So again, what Dwayne mentioned earlier about moving people, and that can be done by using different multimodal facilities. Dwayne or Gabe, do you have anything to add for this slide right now?
I think you covered it, GR. Sounds good.
We have a sense of what the delay is now.
Yeah, I know.
Yes.
Forgot about that. I'm like,
So why shift towards multimodal transportation improvements? In our valley, we have some unique hurdles to overcome, and we're not usually in the business practice of just adding more lanes to roads. In fact, I think a lot of people in this community pride themselves on not just adding lanes to roads. We do have projected long-term growth, which means more travel demand. We'll have more and more people moving from point A to point B. And I think looking around the counties, particularly in the Upper Valley, you get to see that a lot, especially a couple weeks ago when we were a little bit busier around here. As I said, we do have that limited ability to add lane miles to accommodate more vehicles, especially in the unincorporated portions of Pitkin County outside of the UGB. You know, just even to add things like a bike lane and shoulders and things like that up just 4,000 feet in the Castle Valley. I mean, that's a pretty monumental project for a short, not even mile-long stretch of road. And so that's always been one of our biggest hurdles here. And we invest a lot in multimodal facilities, whether it's the Brush Creek Park and Ride or you know, the underpasses that we've built in the past. Things of those natures are very typical of the types of improvements that we are making in Pitkin County. Gabe or Dwayne, is there anything for this slide 5?
I think you covered it nicely, GR.
And for those of you watching at home, sorry this is going a little bit slower than our normal presentation. So we've put together a list of projects, and these are proposed projects. And with things like this, we have a little bit of chicken and egg conversations amongst staff, because we don't have a robust capital improvement plan for our road program through our Road and Bridge Fund right now. In fact, we're looking for a contractor as we speak for the one major capital improvement that we have on our 10-year plan right now. And you will see that that project is listed as number 5 on our chart here. But most of the other things that we're doing, like the Brush Creek Park and Ride, and things of those natures, are types of multimodal type of improvements to the transportation system. The dynamic message sign that the EOTC is looking at right now, and we're looking for a contractor for that. That's another type of project. In the future, you know, staff would like to work with the board to start identifying more projects and nailing down some of these unspecific projects that we have listed on the list right now. And I think it might be more appropriate to do it at a work session where we have everyone and we can be a little bit more collaborative. But if there's input right now that the board would like to, this is a good point to kind of take a step back from the PowerPoint and discuss if there's types of projects that the board would like to direct staff to look at for including in these types of analysis in the future.
Good. Okay, going to the phone, GR has posed a question. If you would like to give any input for capital plans that might be considered on this list in the future, if that's something you'd like to bring up now, please do so.
This is George. It's sort of a tangential question to this, based on this morning's conversation, because when we look at our capital improvement plans generally throughout the county, we utilize our sales tax dollars for that, but the sales tax dollars gives us the flexibility to switch from capital needs to operational needs when that's warranted. And so again, based on this morning, I think we're going to be seeing, at least I would say for the next year perhaps, that we may be shifting our sales tax dollars from capital needs to operational needs to meet our emergency. So it's just something to think about, especially depending on how long this pandemic lasts. If it goes into the summer, we're going to be seeing a substantial decrease in our sales taxes collected.
That's a very good point, George. And I think it actually emphasizes very nicely the need to have a diverse revenue stream to be able to take care of our infrastructure and make needed infrastructure improvements over the long term. And one of the things to know is that this list can be refined over time. It's not something that is necessarily set in stone. It's a good piece of this analysis to show that we do have a lot of need in our community to make infrastructure improvements. And this is kind of that point, though, of the policy decisions of this Board of County Commissioners to fund about under $3.5 million over a 10-year or so study period to drive those fee amounts. Gabe or Dwayne, do you have anything to add to this at this time? Or Catherine?
No, I think you've got it.
I do have a question. Yes, Steve, go ahead.
GR, or to all of you, I think some of the most pressing needs we have to do with the state highways that we have in the county. The Sheriff's Department patrols the state highways. The state oftentimes is not doing improvements that need doing, and one example would be the paving of the wider paving of the shoulders on 133, which the state, the last time they paved it, they actually made it narrower instead of wider. And I don't know how we would pay for that, but it's a pressing, I see it as a pressing need in the county, and we should maybe talk to the state and see if there's a different formula for, if they're not going to do it, maybe they could get some money to us to do it. Thank you.
Thank you, Steve. I'm, you know, from staff perspective right now, we'd like to also be able to do a lot of the projects that that we look at on our own roads at this time before we really expand out to trying to partner with the state on the state highway system. But it is, your point is a very, very poignant one in that I think transportation infrastructure in general at this time is pretty strapped for revenue. You know, the taxpayers, both locally and on a state level, have been asked a number of times in the last decade to 12 years to get dedicated funded towards those things. And up to this point, we've not been very successful. These types of fees, while they generate a decent amount of revenue for the county, they are not enough to look too broad-based at monumental changes in the way that we do business. There are things in here that are partnering with some of our other agencies, when we talk about the Brush Creek Park and Ride and things of that nature. We certainly are looking at trying to relieve some of the stress on the state highway system and partner with RAFTA and CDOT and the city of Aspen.
JR, I have a question. With regards to this list, how does this list sort of relate to other transportation planning information that we have? So we have, you know, our regional transit study that's been looking at multimodal uses. We have our comprehensive valley transportation plan from the EOTC. We have our own road maintenance plan with when those projects are slated to get done. So how did these 6 sort of come from those or get identified either on their own or from those other plans that exist?
Well, to answer your question, Kelly, it's a little bit of all of them. And there are things that we felt like we could pull from a lot of those different plans. And I guess if you had a Venn diagram, this would be, you know, have a lot of those plans off to the side of it, and this would kind of be in the middle of a lot of them. as far as trying to get some sort of contribution to a lot of those transportation projects moving forward.
And are these selected because they can be identified to, you know, how the fee is generated? So they can be directly correlated with a growth or development impact?
Yeah, and I'm going to actually ask Dwayne to answer that question because he's literally the expert in the subject.
Yeah, this is Greg here. Kelly, if you could ask, I don't know if GR is in the room, but I can't hear very well. Sorry. It sounds like the microphones are going out, but yours is still good. So I think there's something wrong with GR's mic.
Is your mic on, GR?
My microphone is on. Sorry, I feel like I have to be about an inch away from this one.
Okay, we'll do better, Greg. Thanks for the reminder. So Dwayne, back to you.
Yeah, to answer GR's question regarding the kind of the math and how the fees work, I think you'll see when we go to the next slide that this roughly $3.5 million here is more or less the key driver of the amount of fees because it's being divided by the projected increase in vehicle miles of travel over the next 10 years. So the policy decisions that you guys are making as the county commissioners is that really we are expecting impact fees to fund roughly $3.5 million worth of improvements. There aren't radical changes to the amount of or magnitude of the fees. There are some shifts. For instance, a little bit lower fees for smaller units and higher fees for larger units. But the overall impact, the budgetary impact, is not that great. There will be a little more revenue expected because the county generally, the housing is being built is more upper end housing, and so therefore with the new fee schedule, it's going to generate slightly more revenue. But the amount of dollars collected, which is a function of the growth rate in the community and the fee schedule, is not in millions of dollars, but only hundreds of thousands of dollars. And so it's not a major revenue source like sales tax, but it is an important revenue source.
And it's Gabe Preston here. And to the question about, you know, how do these projects relate back to the overall demand for transportation capacity. You know, if you read down through the list, some of them, you know, GR had pointed out these are not set in stone, but the types of projects that are listed here are all types of projects that could be characterized as system improvements, and so that's going to be something that, you know, in the future, as the board considers capital improvements planning on an annual basis, you know, for example, when you look at multi-use paths not in the right-of-way, you know, we want to kind of make sure that those types of improvements are kind of part of the core multimodal transportation system. And that they're not, you know, serving just a specific neighborhood and that sort of thing. So that in defining these types of improvements, the consulting team and the staff there had that in mind. So in the sense that they're system-wide improvements and we have this projected growth in vehicle miles traveled, the idea is that some of those vehicle miles traveled might be accommodated by these multimodal improvements, and that's sort of the connection there.
Thank you. And Patty had a question?
Yeah, I don't know when the right time to ask this is, but in looking at the fee schedule itself, I appreciate the fact that some of the fees have gone down, and where appropriate, some of the fees have gone up substantially. Kind of, as far as the residential, it kind of mimicked what we just did with our reason housing impact fee. That's where those numbers ended up. Especially with the bigger homes. But I do have a concern about lodging going up almost $4,000. And so if we could at some point talk about that, because we specifically address with the housing impact fee lodging and not wanting to hit that, you know, because we don't have very many lodge opportunities in this community. So maybe, GR, when we get to the point of discussing individual fees, we can vet that one a little more.
This is a great time to bring that up, Patty. And, you know, on the staff level, when we looked at lodging, we don't have, as you mentioned, a lot of lodging that's in the unincorporated areas. Things like the Inn at Aspen and then out in the Redstone community are really what I can think of off the top of my head. And correct me if I'm wrong.
Hey, Kelly.
Yes.
Kelly.
Yes, George. Can you tilt the camera? Yeah, turn it a little bit that way. Thank you.
George not here?
I don't. George, did you have something to interject?
Hello. Hello.
Hi, we can hear you. You're on mute.
I'm on mute. Oh.
Well, maybe not now because you heard me.
Huh. No, I'm not on.
Okay. Okay, we can hear you and see you fine.
After Patty's question, it just went kind of dead. So I don't know if someone was not speaking clearly into the mic or not.
Okay, our apologies. So GR was discussing the increase in the lodging fee.
Okay.
All right.
I'll have to catch up at a later
That's a little
date.
bit louder. Okay, you know.
Better mic.
So, and I'm gonna lean on Gabe and Dwayne for this one a little bit, but my understanding is.
So you have to keep it sort of tilted and things. Okay.
My understanding is, especially for things like residential, we're talking about net effect. Mm-hmm. Okay, and so the net effect is if you have, say, an 8,000 square foot house, and you want to put on 1,000 square foot addition, that you pay the fee for 1,000 square feet, not the fee for 9,000 square feet, because you've already developed that 8,000. And if it has been in the last 20 years, you've already paid an impact fee on that first 8,000. My assumption, unless I'm corrected by Dwayne or Gabe, is that with the lodging is that this fee per room would only be for the net effect and increases of rooms. I don't necessarily have a good example in unincorporated Pitkin County, but when you do look at a lot of the lodging redevelopment that's happened in and around Aspen lately, the net effect on a lot of them is actually not great. Like the W, I think was a net of 14 rooms or something along those lines. I don't remember the specific numbers, but it was something like 90 to 104. And so that's how that fee would be calculated on lodging. Now, if the other thing to know is, I know with some of these fees, and again, I'm going to lean on these guys to correct me when I'm done talking, but there is also an opportunity.
Yes, George.
Maybe it's just me, but I'm not hearing any of the conversation. Is Greg or Steve, are you having the same problem?
Greg or Steve, are you able to hear?
Greg, I'm actually hearing. I'm hearing GR, and I hear George. I'm hearing everything. Thank you.
Yeah, I'm able to hear okay.
Huh. All right. Well, it looks like it was working great for a while. But if you can hear me, I'll have one question for GR, and then that might sort of be it for me here. Can you hear me, GR?
I can.
Go ahead, George.
Yeah. Jill, when you were talking about, we go way back to the impact fees. We're talking about the road impact fees and utilizing those for these projects, correct?
Yes.
Yeah. So my question or my point is, right now we're looking at upgrading the minimum size homes for the fees from around 5,700 square feet to about 10,000 square feet. Is that correct?
Question. I'm sorry.
Can you repeat that, please, George?
can't hear the response.
It's George. I'm sorry. I couldn't actually hear your question. Can you repeat it one more time for me, please?
George, can you repeat the question, please?
Can you hear me?
Yes. Can you please repeat the question, George?
Oh, okay. Let me try to move this up.
While George is doing that, I can point out also there's a text thread on our online thing, so you could actually send a text message that Kelly may be able to read if we can't get through with the verbal. You can send a message to Kelly on video link.
And we can get back to my
chat
question.
if you need to.
Yeah. Well, if you can hear me, GR, my question is, the 2020 upgrade, you're increasing the square footage of the homes, correct?
Yes, that's one of the things that's contemplated is having additional categories of homes that goes up to a higher category.
Yeah, I'm running out of space here. Here, let me try moving here.
Get back to my question. I never got answered.
Let's try this again.
No problem.
Thank you.
GR?
We can hear you, George.
All right, well, okay, so here's my question. We're looking at increasing our fees based on the house size, correct?
Some of them are actually going down, George, but yes, in general, we're looking at increasing the overall revenue.
So my question is, right now we're utilizing heated space.
Heated space.
And I know that, especially when we get into large homes, the impact to the road goes far beyond just the heated space in terms of the subspace and all the excavation. It seems like we should be utilizing the entire size of the home, which includes heated and unheated space.
Thank you for the question, George. I'm going to actually, Catherine is in community development, and they're the ones that assess the fee. And can you chime in, Catherine, with why we're doing the heated square feet?
Sure. Well, can you hear me okay, George?
Yes.
Okay, great. So one point of clarification is right now the way our fee schedule works is one puts in their heated square footage, both what's existing and what's proposed, and they are assessed a fee based on that new heated square footage, and it can range from 100 square feet, but just up to that 5,800 square feet. So anything above 5,800 square feet right now, which is a flat fee, things are kind of capped at that level. So with these new fees, we're able to, based on our specific traffic counts that GR does through Public Works, we were able to expand that whole fee structure up to the 10,000 square feet. So that's an improvement, at least in the way that we're able to capture more of those larger homes. One thing also with GR's specific traffic counts, those somewhat inherently count some of those trips that are associated with trucks bringing off additional excavation that's associated with those larger homes. For example, GR's counter at the bottom of, say, Castle Creek, that's capturing all of the trips that are coming, not just folks going to work or going to school and so on, but it's capturing the landscapers, the other help that these homes demand. So inherently, because these traffic counts were very specific to each of our traffic sheds, as we call them, we're able to capture more of the impact than one might if they were to do a more generic analysis. Does that help answer your question?
George, I just want to check in to see if you were able to hear Catherine's answer to your question.
No, I got most of it. I missed some of it, but that's all right. You understand my concern and my comments, so.
One last thing to add on to what Catherine just said too, George, is one of the things is that community development is working towards trying to assess all these impact fees on the same calculation. So it's going to be standardized for all the impact fees across the board based on what I understand is that heated square footage.
Housing impact and the road.
Yeah, housing impact and the road impact fee. And then I want to circle back to a question that Patty, that we got started with Patty over the lodging and concern over the size of the impact fee for lodging. We can certainly look at that calculation and make adjustments if directed to do so by the board. That being said, I'll go back to the point that I was making earlier, is that most of these impact fees are really just on that net effect. So if one of our lodges, say in Redstone, were to add several rooms, 3 rooms or something like that, and they're already a 20-room lodge, they're going to end up with 23 rooms. They're not going to get charged for 23 rooms. They would get charged with 3 rooms. And then also, I'll let either Dwayne or Catherine chime in on what we're able to accept, maybe alternative analysis for those fees if, say, a traffic study or something of that nature is presented by the applicant.
Yeah, this is Dwayne. That is an option to present an independent study. I looked back quickly at the 2009 study. The main reason for the bigger increase is just due to the updated trip generation rates published by the Institute of Transportation Engineers. The previous multiplier was only 5.36, I think it was. Let me look. 5.63 trips per room. And the new multiplier is significantly higher. It's now up to 8.36. So that's just due to updates of the trip generation rates in the most recent data.
We have a question here in the room from Patty.
Yeah, to clarify that, so I understand, GR, that if they have 20 rooms, they're going to go up by 3, but that's almost $20,000 based on this increase. So it's like $6,235 per room. And so, say for the Redstone Castle, their land use approval has approved all these little cabins. Would the bedrooms in those cabins be considered, or is that not considered part of a lodge? Because we want the Redstone, we went through a lot of effort to make that approval, and I'd hate now to be slapping them with this increase of almost $4,000 per room, which may again cause some concern.
That's a good point, Patty. And again, we can probably look to adjust some of these specific fees based on direction from the board. But again, as Dwayne said, folks like the Redstone Castle, as an example, are pretty well versed in producing their own traffic studies. And if they can show us that they're going to be producing, something lower than that 8.36 trips per room on an average weekday, then I would say yes, there is an opportunity to lower those impact fees.
So it's kind of like an appeal process.
Yes.
And Patty, I might just add that that's something that exists in our code today, and we tend to keep that section that allows specific developments to bring their own traffic impact fee study forward for review. I think it says by the community development director. So we would maintain that to make sure we assess a reasonable fee.
Right, and I've always been the big one for supporting people being able to appeal things, and so I appreciate that. GR and I talked about it earlier about that being kept part of it. Just want to make it sure that, because that increase, when you look at the increases for, the lodging, it's up there. I mean, a 10,000 square foot house is going up, but we've talked about that with the housing impact fee, that they can probably afford to pay that when we're talking a small lodge, trying to increase their lodging capacity. That's a pretty good hit.
So I want to keep us moving along because we started running behind and we're now still behind. So do you have any more of your presentation, GR?
The board's had a chance to take a look at this fee structure, as you can see with the residential, up to, I think it's 4,000 square feet, those fees are actually going down. Once you hit 5,000 square feet, it stays relatively the same, goes up by about $55. And then from there and above, it goes up pretty significantly on those larger homes. And again, that's because of the very specific data that we were able to use to populate this study. But with that, I think our staff presentation and our consultant presentation is done. So if you guys have any more questions, we're ready for those at this time.
Okay, let me check in the room. Patty, do you have additional questions?
It'll be coming back to us in what kind of form and what's next? 'Cause you said we'd have
yes.
more opportunities to chat.
Oh, that was one thing. Sorry, that was one thing I was going to add was we're here in front of you today just to talk to you about your agreement with our process, and if you are in agreement with how we generally approach things, we'll button up the report and it will go through a full land use code amendment process, which, as you know, involves both a P&Z reading and then two readings in front of you all again. So this isn't the last time you'll see this. So any comments you have today can be incorporated into the final draft, which you'll see at a later date.
Thanks, Catherine.
Thank you. Let's go to commissioners on the phone who have questions or comments.
This is Steve.
Go ahead.
In the chart on page 7 of your report, it's the impact fee schedule for residential. You stop at 10,000 square feet heated, which I don't know what that translates into total square footage, because there are homes being built more than 10,000 square feet, up to 15,000 in some cases. And do they just end up paying the same amount that 10,000 does, or do they pay something higher that's a prorated fee per the extra 1,000 square feet?
Right now, and I can take that. I think, and I'll have people chime in if there's anything to add. But essentially, one of the things when we did this study, the reason that we were able to go from the 5,800 square feet up to the 10,000 square foot mark is because we had better data based on the size of homes in a travel shed. We only have a few travel sheds, or maybe one in the valley, that would be representative of homes generally over 10,000 square feet holistically, and that would probably be the Starwood subdivision. Red Mountain has a lot of large homes, but there are some homes that are certainly smaller in that 5,000 to 10,000 square foot, and so we're looking at an average for that travel shed. The same can be said for over east of Aspen and say Mountain Valley. And so when we take a look at those, if we were able to get data in the future of, say, a subdivision and their traffic that represented those truly monster homes, then we might be able to expand that fee structure in the future. If Gabe or Dwayne would like to chime in with anything else.
I was just going to point out that GR had asked us to make some recommendations about future locations for doing those traffic counts on the larger homes, and so there are some good places. I mean, out there in kind of Owl Creek Ranch and Tyhack Road, and so we've identified a few other places a handful of places where counters could be placed on county roads to sort of track traffic in those big house neighborhoods. But it does, one of the things that is just a reality is that, this methodology that we've used really since kind of the original report in 2000 is based on, averaging the size of homes in a specific transportation shed. And so it's going to be difficult using that particular methodology to hit like the biggest house, which would, be around 15,000 square feet. But I think there's a way with some additional data collection to push that range up a couple more thousand square feet, I think.
Yeah. The bigger the house, usually is, someone said, is inversely proportional to the amount of time the person who owns it lives there. But it's directly proportional to the amount of service people who are driving back and forth to take care of the house too. So the bigger the house, I think it does generate more traffic in general.
Yeah,
so I do like your analysis, the way you tied it in with, you know, the stretches of road and the size of the houses along those roads.
Okay, is there additional questions that you have, Steve, or should we move on to Greg or George? Steve, are you
good.
Okay? Greg, George, do you have any more questions or comments?
Greg here. I sent you a note, Kelly, that if I get lost, you can't hear me.
Yep,
so
I have it. Go ahead.
Articulate that. I'm comfortable with the proposed plan. The way I see it, I think ComDev's done a good job with this, and the consultants as well. I also wonder if we can't just extrapolate or project a bit for the larger houses. We need to do a study here. Tell me if there's a rule that we need to follow regarding our discretion on increasing it for houses over. Maybe we could implement that without having to do more studies. I'd like to suggest that. And then my other comment, I'm going to go back to my note to Kelly here, just in our chat, was mostly around the assumptions we were making just regarding our list of projects that we want to fund. So it changes the subject a little bit. I just want to say that all assumptions that we made yesterday may be off today, and that we should be prepared to revisit our assumptions. It's possible the dynamic message sign will become more important, or the bike paths may be more important, or something else less important. I just don't know. So I know we're not approving that list of projects today. At least I don't think we are, and we'll have a chance to modify it. But I think I'd like to just make sure we understand a lot of the assumptions we've made coming into this might be off now.
Well, Greg, they are assumptions. They are dynamic, and particularly staff is very sensitive to that at this time. And yes, you were making a policy decision when this comes forward again in regular meeting as to what those rates are for the impact fee. But the projects that are listed are the either ones that we're working on now, or conceptual projects that we know are the types of projects that we'll be doing into the future, even with potential economic downturns and things of that nature.
Okay, George, are you still with us? I don't know if we've lost George. I know he tried to call back in. I have just one question. Have you guys run this through the attorney's office to make sure that we're, aligned on how they interpret the use of impact fees?
We've been working very closely with John Ely on this item. He has been continuing to review this, and it'll have all of staff's blessings by the time it gets back to the Board of County Commissioners. We don't expect anything monumental to change about it.
Okay, so I'm just going to summarize what I think I've heard the discussion for the board today is that we support the direction that has been presented to us with regards to our proposed 2020 transportation impact fees, that there is a suggestion to do further traffic study in the future to capture the larger homes, that the list of projects presented would benefit from, I think, broader policy conversation with the board about those projects and how we prioritize that list, that you are thumbs up to go ahead with the code rewrite process, and we would like you to retain the alternate study provision and appeal process that is in our standard impact fee language, and yeah, get the attorney's blessing. And we will see this in future months.
Yes.
Thanks.
Okay.
Yeah, we don't, right now, obviously, getting on agendas and having meetings is a little bit of a different world. We'll update you when we know when we're going to go to P&Z and bring it back here.
And thanks, Gabe and Dwayne. And
Yes.
Catherine.
Thank you to the
Thank
board.
you, Catherine, Dwayne, Gabe, and be
Jen.
well.
Thank you all.
Thank you.
Well handled with given the situation.
I know Kelly's doing an amazing job.
Thanks.
And she made the best soda bread. It's
Thank
really
you.
good.
Okay, so John Peacock has stepped out of the room. So the board,
You need his thumbs up or you're good?
yeah, I think
We're good.
I thought I got thumbs up from you guys, so hopefully we're good.
Can you see if he's out there?
Yeah, what's the next thing on the
The next thing on the agenda is a review of future agendas, and I think we'll need John's input on that. Does the board want to take a 5-minute break?
We have to because we don't have John here.
Okay, I'm going to say let's take a 5-minute break. I have to use the restroom as well. We'll grab John and we'll move on, and I'll try to speed us up. Sorry for the time.
Sorry,
3:15. You okay, George? Did we get you back? I can't hear you. George? I saw your screen and then...
send you all. I will weed these out and not send you all
Okay,
of them.
thank you. Welcome back, everybody, to Board of County Commissioners work session on March 17th. We are talking about our future agendas for our work sessions and regular meetings.
Look at George is moving
Oh
out of the
my!
camera.
So, John,
he's got a corona.
what is your?
Inappropriate?
Oh, jeez.
Oh, boy.
What is your future ball or your crystal ball? say
Well,
for
this is
future
just a really
meetings?
great question. First, for the board's information, it is our intention. We've been working with the attorney's office and watching what the state's doing. It is our intention to close this building to public access as well as any that are not on the front line of the response. And so still will be open for employees to do their work, to respond by phone. They've been working on the protocols for recording. Motor vehicle, of course, can be done online. Those were really the only two publicly facing services that were still open and available. That does impact a little bit, potentially, how we do our regular meetings going forward. I think as we've seen today, this has been a good experiment in using the electronic means, but it does take a little bit longer to get through the meetings. My concern looking forward at future agendas, so particularly next week we have a regular meeting, and that regular meeting will likely have some items on it that will have some public interest. First, let me get the easy ones out of the way. The EOTC meeting is canceled. We did not see how we could achieve social distancing with 15 elected officials, even with the online component. We were trying to figure out an electronic medium for doing the Garfield County meeting, joint meeting, but it looks like that one will be canceled too. So those are two easy ones. In terms of the work sessions, I think we're able to probably continue doing work sessions because they are less public comment and public hearing focused than the regular meetings. We may need to look at, if we're going to continue to use the electronic format, thinning out our regular meeting agendas a little bit, putting off what we can, and or identifying the items that will likely have high public interest or comment, unless you guys felt good about how this roughly worked today, taking that public comment online. So maybe if we open up from just a big picture, how do we want to approach this over the next couple weeks until we figure it out? We can slow things down a little bit.
Okay, let me go to Patty here in the room.
I would like to continue. Our next regular meeting has a lot of, I think, issues that may be of public concern. I think it might be good to move those a bit. Let us continue to vet this system, see how it works, so we can streamline it a little more or improve it a little more. Or, you know, we had a little bug with George and being, you know, couldn't hear us and could hear us. Rather than test it when we have a lot of public, might not be a good test. Might be better to test it incrementally instead of wham. I don't know how the rest of the board feels about that, but if you look at the agenda for the 25th, it's a pretty heavy agenda. Just a thought.
Kelly?
Yes, go ahead, George.
Two things. On the work sessions, John, I noticed that it's still pretty light. And some of our work sessions, like today, didn't start till 1 o'clock. So I think we can accommodate more of an agenda and have sort of our normal work sessions, even though it may take a little bit longer. We've got a few more hours to play with.
Yeah.
So, and during work sessions in general, we don't take public comment anyway. Today was a special meeting, so that's an exception. In terms of the regular meeting on the 25th, I can't pull up my agenda because I'm looking at this. But I think we need to move ahead and try to figure out a best way to address public comments. I think Kelly did a great job today in terms of call-ins, and maybe that's a way to try to do that. But I think there's enough on the agenda, and it's just going to grow, as we know, as the months move on, that to postpone some things, I think, is probably not, for me, is probably not a great answer.
Steve or Greg?
This is Steve. On the public comment, I think you could just do a call, one ask. Is there anyone on the phone from the public who would like to make a comment? Then if there are a whole slew of them, then split it up alphabetically. But if there's only one or two, you could just take them, just call for one of them and then the other one. Because usually there tends not to be any public comment. So I think that would speed up the public comment part of it and maybe be able to keep the meeting moving on a regular pace.
Greg?
Hi there, thank you. I tend to agree with George. We're going to have a lot on our plates if we can keep hammering away at it. I'm actually comfortable. I think we've done a good job with our first teleconference here, and as we work out the rough edges, I think it'll be worth perfecting this, and I'm sure we will. I'm concerned about the big meetings. I've had people inquiring about the airport process. How is a public meeting on that going to go? We do need to be planning for that, and I'll defer to John Peacock on that one. But I'd like to see these things keep going, because I think I don't want to see the work pile up with all the surprises we're getting.
So when I look ahead to our next week's agenda, I guess my first question is, do we continue to have a joint meeting with Garfield County?
I think that's canceled.
Okay.
Yep.
So we think that's canceled. There are some timely things on that agenda for our work session that I think means we should retain it. A census update is timely. Jessica Vallen's presentation would be very timely. She's reached out to us about how to help with COVID response. And so since we already have her on the agenda, it would be great to keep that. And then the other things, I think we can facilitate, hopefully online or call-in interviews. With regards to the 25th, we do have some things for second reading and public hearing that might warrant public input. I don't know if you know if any of those are planning to be continued, John, specifically the energy code and the, I don't know if the Holy Cross easement will have, generate much interest, but those and then the Maroon Creek plans.
Yeah, I do believe the energy code will be
Continued.
Continued, correct. I have not heard yet on the other two items.
Okay.
I think that the items Maroon Creek are continuing to be on the agenda. We did have a lot of public comment at the first reading, so we'll just have to let them know the circumstances. I don't have a problem doing work sessions. I think that's a great way for us to work through this, but we have, technically right now we have 14 items on that 25th meeting, so and if the energy code is being continued, which is my understanding, then we have 13, and so maybe we can check with Leslie Lamont and see what her feeling is about public comment on the Maroon Creek issue.
I mean, I would, yeah, go ahead, George.
A comment on that. Maybe what we could do is, as we talked this morning in terms of limiting space, we have our room next door,
We're not going to have people in the building.
Right adjacent, and which can be televised, and maybe we could sort of, if it's just a dozen people, we could put people in that one room and then have one or two come in for public comments directly in front of us, and just kind of move people back and forth just to space people apart is an idea.
George, right now our intention is to close this building. until at least through April 8th.
Oh,
But-
okay, so even for meetings, okay.
Yeah, but I think we can have a call-in number so that anyone who has a landline or cell phone or such would be able to do public comment. It's just a little bit more of a challenge to manage for the chair if
mean,
we have a lot of people.
I guess I would propose that we forge ahead next week using these new technologies. And then if we identify that Wednesday's meeting takes longer than we think it should, then we'll know we need to truncate our agendas or start earlier. I don't think we're going to have a ton of public comment on the agenda items for Wednesday.
Especially
We
if
could on one or two, but not for the remainder of the items.
Well, and having the energy code moved will
help
release a lot of space. When you look at the whole thing with the energy code in there, that in itself is going to be a lengthy process of presentation because it's a lot of information. We don't know what the public, we haven't had a lot of public comment on it yet. Doesn't mean we might not have a lot. So I think we just go ahead and plan for the duration to be here for a while on the 25th.
Now, we have the option of starting that meeting a little earlier or just taking the chance that it's going to go a little later.
I think we
It's
just
kinda up to
started
you
at
guys.
noon. People are used to noon.
Well, and can I ask another question? How is staff time for being able to get us through these agenda items? Thanks, Andrew.
Thank you.
I mean,
Yeah,
your time, other.
Well, what
time.
I would suggest is you may have some other people sitting in the seats, or as long as you're okay with, as I have been today, popping in and out of the meeting. I think I am going to huddle with my group as far as how we cover you guys, and also respond to the event. I think right now. Sorry, I'm just looking ahead. There may be some items where staff, Nan, for example, may not be able to be here to cover the IGA with Garfield County, but I think that's something we can do. We may also look at, for first reading items that aren't public hearing, do we want to move some of these to the consent agenda so you can move through them quicker and spend a little bit more time
I think the agenda is fine to the way it is, as long as with energy code off. And we just ask Leslie about what she thinks might happen with Maroon Creek.
Yeah.
If she thinks it's going to be a lot of people, we'll have to reconsider.
Yeah. Then so we'll work to move ahead, and then if we're feeling overwhelmed, if we have another curveball, we'll communicate with the board midweek and let you know if we need to push some things off.
Does that sound good to those on the phone with regards to next week?
Yeah, that's great. I'm fine with that.
And
Yep, sounds good, Kelly.
I'm good.
And I would just note that the elected officials ski day with Eagle County
I
on
was just
Friday,
gonna
March
say.
27th has been canceled
Oh,
also.
gosh, we're not going to walk up the hill for lunch?
6 feet apart.
Well, why don't we start there?
I do have one.
Okay.
I have one on April the 8th, the regular meeting. Can we move the GMQS text amendment second reading ahead of the ski company item? In other words, move 7 to 6 and 6 to 7? And then I noticed the rest of the agendas are pretty wide open, so I think we're leaving it that way till we see how things go, and then we can start putting them in, would be my understanding.
Is everyone okay to take this on a week-by-week review?
Yeah.
I'm good with it. Likewise, I think the key words are at the beginning where all the future agenda things are subject to change and cancellation. And that's the order of the week every week, I think.
Yeah, we're leaving it in bright red there, aren't we?
Yes.
Okay, let's move on to board open discussion.
I've covered all the things that we've been talking about this week.
Okay. In the room, Patty, do you have
I
board
have
open discussion?
one issue we didn't discuss, and I'm sorry I didn't think of it at the time with our public health issues right now, is construction activities. I did receive a call from somebody who has a small construction firm wondering what he should do, and I said depends on maybe on your specific project. If you have, 5 different disciplines of construction all working in a 1,000 square foot space, probably not a good idea. But I don't know if that's being addressed at any level, or if anybody has even thought about it.
Yeah, and actually, we provided a brief answer yesterday in the community forum, and so the answer is all about social distancing, just like it is for everything else. And so the work site needs to be able to accommodate those social distancing standards between workers, and also needs to provide the sanitary facilities so that workers can wash their hands frequently and address the hygiene factors that we've been pushing out into the community. If if a job site does not facilitate either of those things, then that job site should be shutting down. If they're able to organize the work to facilitate social distancing as well as the hygiene practices, that's our goal.
One of the problems is, if you see on construction sites, when there's breaks and lunch, that's when they all get together. So they need to, that's their social time on the job site. The other one is they've been encouraged to carpool for all these years, and now being in the same car together is probably not advisable. So those are things I think we should also be, when we talk to the construction industries, very specific about those. Besides the space of the construction site, the activities that take place in the norm from the past and now the new norm.
It's just like all of us in this room today.
Yep.
We typically be working closer together, all in the room with a packed
Right.
room, and conducting public business that way.
But we're more informed, and I don't think the contractors and the carpenters
Yep.
are necessarily been, so that's worth something when we go out and do site inspections, because we might have some things that need to be done from our building department that they also educate when they go out.
Thank you.
I had one
Okay,
one other real quick.
Yep.
Our discretionary fund, we had some monies left over from last year that we were rolling over. It's not a lot, but do we want to consider taking some of those? I don't know, maybe you can check with Nan to see if Food Bank or anybody could use a couple $1,000 infusion now, or I know we're looking at that in a broader picture, but it might be something we could also look at.
We'll be sure to keep that.
Thanks.
in mind.
Any open discussion from board members on the phone?
Nope.
Kelly, if I could, I wanted to go back. Greg was asking about the airport meeting, which we had originally scheduled for April 16th.
Yes.
Which is about 1 week after our initial public health order runs through. Greg, we're still talking about that. That's a meeting right now because of the high public interest that we've had throughout that process. We feel like we either need to move or figure out a technology solution that's going to be able to accommodate several hundred people and a lot of comments. And we're just not there yet. And so I think that we may need to be considering moving that meeting, but maybe getting a final report of the vision committee to the board earlier so that you can start reviewing that.
Which brings me to our 3-ring binders. I know people have been busy upstairs, but those things are a lot of information for the board to go through, which we could be doing in a time when other meetings have been canceled. So that would be great to get out to us, and rescheduling our meetings with you so that we all have the chance to chat with you so we're all on the same page as far as information, not on decision, but information.
Yeah. Give me 1 more week.
Okay. Does Greg or Steve, do you have open discussion? Greg?
Yeah, Greg here. Just wanted to say thank you, John, for that update regarding the airport discussion. I know the big items are going to draw a lot of attention, and we should figure out how to accommodate them. I noticed that on the public meeting we had the other day, the Zoom teleconferencing shut down after 300 visitors, and I understand that that's not necessarily the case. If it's set up perhaps in another way with a different sort of account, you can actually have 1,000 or more people on one of those Zoom conferences. And so I think that needs to be investigated further. I just heard today from a guy who just did 1,000 people on a Zoom conference. So just a heads up on that there may be a way to extend those for something as large as an airport discussion. Thank you very much on that. I think that's all I have for now.
And Greg, and just for the public, we have been looking at and actually have requests in to expand some of that Zoom licensing right now. That is a product we use. No surprise, they're getting a whole lot of requests right now, and it is taking them some time. And so we're still we've been on that, and we ran into that yesterday with our community forum, which we did via Zoom. We had interest beyond the 300 participants, and some people couldn't get on. For members of the public that couldn't, we apologize. We did try and expand that licensing, and it just wasn't available yet.
I was able to watch on Grassroots.
So I was struggling. I tried a couple different ways, and then I just went online and streamed the Grassroots TV, and I could watch the whole thing right on TV, and that worked fine. I mean, I watched it on my computer screen.
I have one thing, John.
Right. The last thing I was thinking.
Sorry, Greg. Go ahead.
Sorry. Go ahead.
No, you go ahead.
I was just going to say several requests have come in for people asking how they can help, and I know it was mentioned earlier. If we are including that in our database on our website where people want to be able to help out. I think as one of the psychological counselor people mentioned this week, giving people a way to help out really helps the health of the community. Just to know you're actually helping give some service and take your mind off all the stress. So there's multiple benefits in allowing people to help us somehow, one way or another, through volunteerism, delivering food to the elderly, call center, things like that. Just so hopefully we'll have a great resource there on our website.
And actually, on the county's website, if you go to the homepage and click on the COVID-19 tab, one of the first things as you scroll down you'll see is an email address to the Aspen Community Foundation for folks who would like to volunteer. So there's an email there for anyone who wants to volunteer. We're collecting that resource list, and we'll be trying to find opportunities for people.
Okay, John.
Thank you for that, John. And I know how quickly everybody's moving. I understand how fast and how responsive the staff has been with all this stuff that's coming at you. And all I can do is express mine and the communities. The Aspen Institute, for instance, contacted me to say, thank you for what you're all doing, and they all understand what's going on now, and I think everyone's very grateful and impressed by how you are handling this, how the IMT is handling it, and the EEOC. So please express our gratitude to everyone we don't see in person.
Thank you so much, Greg.
And John, with regards to COVID, the big topic of testing, I just wanted to bring up. I know, we have a very clear explanation with regarding to the testing situation in our community. I think one of the things that I feel like I'm lacking is the broader, big picture view about what testing should be, what we would want it to be, why we think testing would be valuable. It's just we're hearing a lot of information from global experts and down to local community, and I'm just lost as to what we want that to look like if there's an ask around that for our state and federal leadership about what that should be, what we think it would serve our purposes for, even in the we know what the short term is, but what does the midterm, long term look like, or do we just stay in the situation that we're in? And I don't know if I need that answer. I think it would be helpful as
yeah.
the team continues to work to understand that from a policy perspective a little bit more clearly, that we hear tests are coming online, we hear testing's happening around the state. You know, what is the big picture?
And you know, I think we can ask our public health staff to put some clear bullet points around that. Just briefly, the conversations that we've had, testing is really for two different purposes. One is a public health purpose, and that public health purpose is collecting data to understand how the disease is spreading, where it's spreading, where there are hot spots, where there are not, so that you can develop mitigation strategies, broader public health mitigation strategies. The other is for testing for healthcare treatment purposes. For the statistical model, you need to be able to do a lot of testing, and you need to be able to get results back fairly quickly so that you can develop those strategies in a time frame that really helps you mitigate the impacts. We do not have the infrastructure for that. And when I say we, I do not mean Pitkin County. I mean as a country, we do not have the infrastructure for that. As a state, we do not have the infrastructure for that. And certainly locally, without the other two, we don't have the infrastructure for that. So our testing is really around medical need, and that's where our strategy is right now. I know we would hope that if there was broad-based and quick testing available, and that's affordable, that would be beneficial. So we'd love to see that type of infrastructure available. Would have been great to have a week ago, for sure. But we can ask public health to put probably clear and technically more correct bullet points around that.
That would be helpful.
I want to add to that, though. I've had a call twice, and it's for somebody who I assumes I know who's calling, but I haven't been able. They don't give a name, and I don't recognize the phone number. But about people getting off the airplane and being tested. And I'm like, well, if they get off the airplane and we test them, where are we holding them while we're waiting for test results? We can't hold them in the airport. So, and there's a screening process, it was my understanding, at other airports before people get to our airport on commercial. So maybe we could get some information, because there's a lot of confusion about the airport.
Yeah, so in airports that particularly are accepting international flights.
So major hubs.
Yeah, they're doing screening, symptom-based screening. So it is not testing. It is not, swabbing or anything like that. But they're doing temperature checks or symptom checks, particularly on the international flights. We obviously are not an international airport, so that's not happening. But presumably anyone who's traveling internationally has had that. And we're all asking that travelers be responsible, whether you're leaving our community or traveling anywhere in the United States, that if you have symptoms, you should not travel. If you're part of a vulnerable population, you should reconsider your travel plans and the exposure that you might experience while traveling. And here, we're definitely seeing a significant reduction in traffic going in and out of our airport or any other means of travel.
Okay, is there any other open discussion items?
This is Steve. A little different perception on the testing, and that has to do with the uncertainty and the fear that gets put into people's lives if they're not able to get tested. Like even in my case, I'm in the vulnerable population. I have symptoms which might or might not be COVID-19. It doesn't merit testing under our current guidelines, but I will really not know going forward whether I have any immunity to it or not. And there are a lot of people who have symptoms. Maybe it's just a bad cold, maybe they have a little influenza, maybe they have COVID-19, and they're going to go forward into the future not knowing whether they had it this go around or not. And then when the virus comes back, then the next big season, or if and when it comes back, which I suspect it probably will come back for a second go around at some point, those people will have this fear. They'll have to be basically self-quarantining again, just out of fear that they don't know whether they had it already or not. Unless we can get a good vaccine and get a high percentage of the population vaccinated, and then that would deal with the issue right there. So if there were any way we could have a test or a blood test to do later on to see if you have developed any immunity to it or something that would alleviate people's concerns, I think we should try to achieve that.
Kelly, the thing too, Steve, with vulnerable populations, especially those, exhibiting what could be symptoms of concern, what we're advising with the county hotline, or the multiple county hotline, is that you contact your primary care physician, especially if you have a specialist physician like a cardiologist, and ask them what they recommend. And John, clarify if there is a request from a primary care physician for testing. Is testing still available?
It is still, those individuals then are still triaged based on symptoms. And the reason for that is the limited testing capacity that I referenced earlier, 160 statewide, right. 1% of the population in 1 year. And so from a medical perspective right now, in the absence of a vaccine or any other treatment, whether you have a cold, flu, or COVID-19, the recommendations right now are the same. For those that advance to more serious symptoms and may require a higher level of medical intervention, then those are the folks that would be indicated for the COVID-19.
And that is upon the advice of their attending physician or their specialist. Mm-hmm. Just to get that clarified out there for the general public.
Thank you.
Okay, thanks. Okay, let's move very quickly through board membership reports. I think it will be easier if each board member reports out on all of the boards they sit on rather than going through the list and jumping around on the phone, off the phone. So I'll start with Patty. Lucky Patty can tell us her reports first.
Well, Greg, I'll let you do Board of Health since you are the main rep on that. Northwest COG, we just canceled or delayed, or we will reschedule the Economic Development Symposium. Well, it wasn't scheduled until May, but they decided to plan way ahead, so that has been postponed. There was a workforce meeting, general symposium, that was canceled, and I don't know if they're going to reschedule that. Northwest COG's meeting is next Thursday. I think Karen Stegelmeyer, who is chairman, I think she's going out of town, so they've asked me to chair, and I may have to go to be directly in attendance in that meeting. I don't know if they're going to, I haven't heard anything about the status of that meeting, so we're on hold on that note. The other one, ACRA, it's my understanding, is looking at deposits going hard, which means once you put a deposit down to rent tents or to rent, trees and flowers and bushes and plates and cups and all that stuff, those deposits go hard, I believe, this week or maybe the following week. They're working on that.
For food and wine?
For food and wine, yeah, thanks. They don't want to really make a decision, without having some good grounds to do it, because the economic impact of canceling food and wine would have enormous consequences on this community, beyond enormous, on top of everything else. So that's up in the air right now. I think ACRA's kind of got their plate full, no pun intended, but they have their plate full on that one. And right now, I think that's the other one. I do sit without board appointment. I try and attend or at least be involved with the Basalt Child Care Coalition, and that meeting was also just done by phone, and I was not able to participate in that. So that's really quick on my boards.
Okay, let's go to the phone. Steve, can you give your board member updates, please?
Okay, let's see, let me look at the list. Senior Council is canceled. The meeting tomorrow is canceled. There is some activity. Several members and Chad Federovich and myself all had tours of a building, an Eagle County building next to Crown Mountain Park that was the Forest Service place where they would store the tree seedlings. It's about a 20,000 square foot building, and Crown Mountain Park was considering using it to have, do an indoor rec center kind of facility. And there was enough space for about 6,400 feet that Eagle County Senior Services could use for a senior center. And so some of us went and had a tour of it, and it seems to have good possibilities. Would take pretty major remodeling, but the building is a very sound building. At this point, Crown Mountain Park Board of Directors is not pursuing that at this time. They decided to not pursue it. It's a pretty major project. They'd have to do a big fundraiser and whatnot. But anyhow, it was something that in the future might hold out some promise. Let's see, Club 20 had meetings on Thursday and Friday. I phoned in for part of them. I did not go down there. I don't think they would have appreciated me showing up starting to get sick right then. And Club 20 is supposed to be having their spring meeting in April, their big one, the 2-day meeting, and I don't see how they could possibly pull it off at this point in time, but it is still scheduled for in April. I think they're probably going to have to postpone that till sometime. Let's see. I think the big CCI item is that our bill got through the legislature and is awaiting signature of the governor, and that's the business licensure for short-term rentals. We started out having general business licensure, and it real quickly got narrowed down to just short-term rentals. But it fairly well flew through both the House and the Senate. Both Kelly and I went down and testified at different times. I went down for a House hearing, and Kelly went for the Senate hearing. So that is like really good news that in this year when a lot more business probably will not get conducted at this time, we got our important bill through. So I'll leave my report there.
Okay, thanks. Greg, could you please report out?
Yes, hi. I'm going to start with the Board of Health. Actually, as you can imagine, all the staff of Board of Health, Karen being our main liaison, are she's on the incident management team now, and so we haven't seen her much, heard much of her because she's focused elsewhere. So she gave us a report on everything we've been talking about, really, online, which is standing up the IMT, establishing the hotline, seeking volunteers for the hotline, which is still, I guess we still are looking for volunteers. We talked about, in that regard, standing up the mental health counselors. That Phyllis and I discussed this over the weekend, and we now have mental health counselors from Aspen Strong, Aspen Hope Center, and Mind Springs Health helping man the call center. So I think I don't need to add anything new other than the Board of Health is standing by and able to participate and participating on some level. Some of the members are already. Regarding RWAPA, we don't have another meeting until May 20th, so there's a good chance, hopefully, that we'll be able to have that meeting in person. We had talked about getting April Long, our director, in front of the BOCC That's, at this point, I'd have to say I'm not going to encourage her to try to get on an agenda anytime too soon. It seems like everything's going well. Our aquatic nuisance species program is pushing along, and I think I've reported on that already. I've been on calls with CC4CA and CCAT, as some of you else have, so I don't think I'm going to report on that right now. But that's it for me.
Thank you. George, can you please report out?
Well, give it a shot, Kelly. Let's see. RAPTA, of course, RAPTA has a program in place that they're following, addressing COVID-19. Of course, they're already scaling back on service based on the ski resorts closing, and they're looking at perhaps what we used to call off-season schedules, and that's sort of in flux, and it's a moving target. Of course, their main concern is to ensure that the drivers and staff remain healthy so they can continue to provide the service, and they're hoping to do that. So that's RAPTA, which is a critical component for our community, obviously. APSHA, at our last meeting, there was an interesting presentation by a couple who live in affordable housing, and what they would like to do is, and they have been working on upgrading their home to make it more energy efficient, and they would like to go to renewables to 100% net zero, which is really admirable. They're running into a little bit of a problem because they're under an OD restriction that limits the amount that they can recapture from their capital investments at only $10,000, which is really nothing. And so we're looking at ways that we can bring them into the newer deeds, which allow the ability to recover their investments, certainly for renewables and going to net zero. The challenge in that is we want to make sure that in that process that they don't go above the cap in their category. But I think there's a way to address that to ensure that they can at least reach their cap in their category without having to go into the next category, allow them to continue to make investments towards renewables, and they may just have to put a little more money in on their own without completely recouping all of their investment. But I think it's a great model. I think we should pursue encouraging people to do that, whether it's free market or employee housing, because that's our long-term goal in terms of our climate action plan. And we'll be, I think, discussing that April 1st. Tomorrow's meeting has been canceled, but that was also on the agenda for April 1st regardless. Let's see, what else do we have? Core, we're meeting on Thursday. We're going to do a call-in, and we'll see how that goes. I'm not sure we'll have all the technology that we have here today, but we'll be doing that, and we're continuing to look at our budget and our challenges for 2021, given that due to our building codes and our projected energy codes, we're going to anticipate that our rent fees will be diminishing, and of course rent drives a lot of those great programs that we see throughout the community. Most recently, their Imagine series, which has been extremely successful and well attended throughout the valley. They've had to cancel the last one or two and then reschedule those for the fall. Nordic Council, so as an aside, it was good to see that John Wilcox and his crew up in Ashcroft are going to offer free Nordic skiing up there. There's no charges, and you have to bring your own gear, but there's still good skiing up in the high country, so thanks John Wilcox and Ashcroft for doing that. And I think that's about it.
Okay, I will blast through my updates. QQ was postponed. There was not a lot of pressing things on the agenda. I know some of our bills actually moved quickly through the legislature there, so I will try to get organized with an update, maybe with Michaela, on some more specifics of our legislative actions. As you probably all know, the legislature is on a temporary adjournment until March 30th. That is with the exception of the Joint Budget Committee that is still working over these next 2 weeks, but everybody else is adjourned. And there's still some outstanding questions about whether that will get extended, about whether the 120 days can be consecutive or if they can be split up throughout the year. So stay tuned on the legislative calendar. So that affects a bunch of stuff I'm working on as far as CCI, CCAT, and CC4CA. I will say our two CCI bills, so the one that Steve mentioned, short-term rental licensing, and our repeal of the septic fee cap, both went through both houses and are awaiting signature by the governor. So we, so that's kind of a win, even if the session doesn't re-adjourn and pick up the bills that are currently in motion for us. CC4CA continues to be very active, in addition to more legislation that they had expected. For this session, there's also a lot of regulatory stuff happening, and we have been weighing in heavily with the Air Pollution Control Division on their rulemaking for greenhouse gas inventory and reporting. That is on a very expedited schedule this spring. And so there's a small group of us who've been working on that, and I've been, talking with our local experts on our own inventories and what knowledge we bring to the state on those experiences. With regards to one bill, so should the legislature reconvene, the bill that had preempted local, excuse me, how am I say this? There was a prohibition on local jurisdictions from regulating single-use plastics. That bill had been postponed indefinitely. It was one of Carrie Donovan's bills. It appears to have been revived. I don't know what the path forward is on that, but we're going to work to seek an amendment that includes counties in that if they reconvene. CCAT and CCI, I will say, are both emerging as good avenues for us as commissioners to elevate concerns regarding COVID response. So, if there's a political element to it, CCI and CCAT have really organized to help be an ear, for us to the governor's office and organize our, interests to them. And so that is grateful. John Swartout has hopped on the phone quickly to give us heads up on things that we're not getting from the state. So that's been helpful. And that's how they're kind of pivoting their activities with the legislature on pause. And I think that's it for now. All right, we're only 50 minutes over. Sorry, folks. John, anything else?
It was technology's fault, Kelly.
Just a quick update, actually. It does look like we are going to try and do a virtual joint meeting with the Garfield County Commissioners on the broadband on Tuesday. They are interested in that, and so we will either set it up on a Google Hangout or a Zoom format.
At 10 o'clock?
Yep.
Okay.
Well, let me know, because I'm going to be here. Can we still come in, or do we have to all do it?
No, employees and board members, this is your building. Yeah, you can come in.
Because my computer is set up for Google. We haven't quite gone to all the other apps yet. So one at a time, please, gentlemen.
And we may stick with this one. It depends who's setting it up.
Okay. Well, I will plan to be here at 10 o'clock on Tuesday morning.
Okay. Anything else for the good of the order?
I was curious if Greg is going to be able to do his family trip over spring break.
Greg, what's up? Steve, thanks for asking. Our plans have changed. We're here. We are social distancing locally. We're getting out and hiking and doing all that by ourselves or as a family unit. And at this point, we're not planning to go anywhere, and we're encouraging people to We saw that note regarding the desert and Moab not wanting an influx of people. So, yeah, we don't want to push problems on anyone else. So I think we're here and we're going to enjoy being here.
Okay, I was
gonna attend the meetings?
My travel plans to North Carolina for the wedding reception thing for my daughter has been postponed. Well, postponed indefinitely, not using the legislative term, but they're probably going to put that off for maybe even a whole year. They will still get married this year, but the end of March trip is not wise and it's not going to happen. So I will be here somewhere too.
Okay, thanks everyone. Thanks Andrew for all your help today. Thanks Grassroots for getting us out to everybody. And cheers. Happy St. Patrick's Day.
Cheers, George. Happy
You disconnected your phone from the meeting.
It is a